Hello guys, welcome to Raghav MedIQ. Today we are discussing about malaria. In this video, we'll discuss both microbiology and pharmacology integrated. Let's begin. Malaria is caused by, first we'll look at microbiology part. Malaria is caused by Plasmodium species. Then there are four major species of Plasmodium. First is Plasmodium vivax, then Plasmodium falciparum, Plasmodium ovale, then Plasmodium malariae. Then coming to life cycle, we have two hosts. One is definitive and another is intermediate. Definitive host is Anopheles mosquito, female Anopheles mosquito. And intermediate host is we, humans. And we have asexual stage in humans. We have three asexual stages. First is pre-erythrocytic. Then exoerythrocytic. Then gametogenesis. First we'll look into life cycle. See, we have two stages of malaria. One is mosquito stage, other is human stage. In mosquito stage, imagine mosquito has taken blood meal from infected person. Then it will that blood meal will contain gametes. Next, that gametocytes will fertilize and form zygote. This zygote will become elongated. This zygote will become elongated and forms ookinete. This ookinete will form oocyte. Now, oocyte will rupture. This oocyte ruptures and releases sporozoites or sporogony. This sporogony is These sporozoites will move to the salivary glands of the mosquitoes and the cycle continues. Now, if the infected mosquito bites humans, now what happens? First, sporozoites entered. Next, this will migrate to liver. In liver, hepatocytes. We call this stage as pre-erythrocytic sejones. Then it will multiply within the liver cells, that is hepatocytes, and it will form exoerythrocytic sejones. Then the next stage is hypnozoites. Then the stage comes erythrocytic sejones. That means these hypnozoites sorry, merozoites. See, in exoerythrocytic agents we have got merozoites. These merozoites will enter or invade RBCs, so we call this erythrocytic agents. Here it is pre-erythrocytic, it is not yet gone to the RBCs. This is also exoerythrocytic, means outside erythrocyte. This is erythrocytic, means inside erythrocyte, that is RBC. Then that merozoites will multiply within the RBCs, and once the time will come where RBCs will rupture. This rupture of RBCs will release hemozyme, which will cause chills and fever. See, now this has rupturing of RBCs has released merozoites. These merozoites can also infect other RBCs also. That's what it is written. It can infect other RBCs also and can cause paroxysm. Paroxysm is nothing but relapsing of fever. Relapsing of fever. Then the cycle continues. It will produce gametes, and gametes will be taken up by the mosquito, and the same cycle continues. Hope you guys understood. Next, coming to the clinical features. We have triad of symptoms. Triad is, you should remember this mnemonic fast. F is febrile attacks. Febrile attacks. A is anemia. S is splenomegaly. Splenomegaly. Then fever paroxysms means for Plasmodium malariae, the fever paroxysms, that is relapse. Relapsing of fever will come or occurs every 4 days. For other Plasmodium species, it will occur for every 3 days. If you want, you can take screenshot. This also. Then coming to lab diagnosis. First, we should do peripheral smear. In this peripheral smear, we have to do 2 smears. One is thick and one is the other is thin smear. Should do 2 smears. Thick smear is speciation of Plasmodium. Then thin smear, sorry, thin smear is for Plasmodium, speciation of Plasmodium. Then thick smear is for diagnosis or pigment demonstration. Then coming to microscopy. You should remember QBC. QBC is quantitative Buffy coat. quantitative Buffy coat. In this we'll do first configuration, first we'll do centrifugation. First we'll do centrifugation of the sample. Next smearing. Next staining. Staining we'll use acridine orange. We'll use acridine orange stain. Then antigen detection. You should remember only for antigen PLDH first one. Second is PFLDH. Then third is for HRP 2. Then antibody detection. We have less important for antibody detection. Usually we don't do. For molecular diagnosis, we'll use PCR method. We'll use PCR. PCR will detect 18S RNA. 18S rRNA. Next, this is about microbiology of malaria. Then we'll discuss about pharmacology. Malaria pharmacology. 1 minute, guys. Okay. First, antimalarial drugs. We classified antimalarial drugs as fast acting, intermediate acting, and long acting. In fast acting, we have chloroquine, mefloquine, artemisate, and artemether. Intermediate acting, we have progranil, and long acting, we have two antibiotics, that is clindamycin and doxycycline. These are all the antimalarial drugs. Then we have drugs to kill pre-erythrocytic sequence, exoerythrocytic sequence, erythrocytic sequence, and gametes. We'll see how. If question comes for a mechanism of action, you should write this life cycle and just show where and all will use the drugs. First, we have drugs to kill pre-erythrocytic sequence. Where is pre-erythrocytic sequence? Pre-erythrocytic sequence. First drug we have to kill pre-erythrocytic sequence. Next is exoerythrocytic sequence. Then we have drugs to kill erythrocytic sequence. Then we have drugs to kill gametes. Then first, pre-erythrocytic agents. We'll use three drugs to kill pre-erythrocytic agents. First one is primaquine. Second is progranil. Third one is doxycycline. One minute, guys. Please note here, there is another drug here, primaquine. It's an important drug. So we have three drugs to kill pre-erythrocytic agents, that is primaquine, progranil, and doxycycline. Next, to kill exoerythrocytic agents, we have only one drug, that is primaquine. We'll use primaquine. Next, to kill erythrocytic agents, we have we can use all the drugs except primaquine. All drugs except primaquine. Then to kill gametocytes, we'll use again primaquine. Please note here, guys. See, to kill pre-erythrocytic agents, we'll use primaquine. To kill exoerythrocytic agents, we'll use primaquine. And to kill gametocytes also, we'll use primaquine. But for erythrocytic agents, we don't use primaquine. Next. For malaria prophylaxis, there is two type of prophylaxis. One is casual prophylaxis, the other is supportive prophylaxis. For casual prophylaxis, we'll use drugs to kill hepatic agents. Casual prophylaxis to kill hepatic agents. We have three drugs. One is primaquine again. The other is progranil, and last one is doxycycline. If you observe clearly, these are the drugs used to kill. We used to kill pre-erythrocytic agents. See, these are the drugs we used for killing pre-erythrocytic agents. Pre-erythrocytic agents. Then for supportive prophylaxis, we'll use first. We'll see. Imagine this is RBC. And we have and we have we have sejoints or sporozoites inside the RBCs. These are sporozoites inside RBCs. We use drugs to kill this sporozoites inside the RBCs. There are three drugs. One is chloroquine, mefloquine, mefloquine, and doxycycline. Chloroquine, mefloquine, and doxycycline. And this is about prophylaxis and pharmacology of malaria. Hope you guys understood, and please do follow RaghavMedIQ for easy conceptual understanding, and like, share and subscribe to my channel. Follow me on Instagram. Thank you.